have sometimes when there is a VIP patients, the Murphy's laws apply. If something is about to go wrong, if it is something is bound to go wrong, it will go wrong in a VIP patient. So we will see how Dr. Ragini handles those issues.
Thank you, sir. Good afternoon, good evening, everybody. Respected Dr. Rajiv Sukumaran, sir, Dr. Sashi Kumar, sir, Dr. Joseph, sir, and all the friends here. So, like sir said, that if there is a VIP patient, what do you do and how do you deal with it? Very simple points that every patient is important and the doctor patient relationship is the most important. Like you saw in one of the slides of Dr. Ramamurthy sir, that many a times what the patient needs is a lot of reassurance. They have problems which you may or may not be able to solve, like the glare and all that, but reassuring the patient is very, very important. So what is important is the trust. You cannot betray the trust that the patient has in you, and always go by the truth. Now, why the truth is because we are a lot of educated doctors and not everybody will be the same. So, if you do not tell the truth, there will always be somebody who will tell them what is happening, even though you don't expect your friends to do so. So, so it so happens sometimes that the patient is very scared, and so can be the doctor, very, very scared. Now, who are the VIP patients? If you have a public figure who's a politician or a bureaucrat, in our country we place them very highly, and they themselves place themselves very, very highly. So the politicians and bureaucrats, the journalists, every time, when I was in a government hospital, if there was a line, the journalist would come and say that I'm a journalist, I'll do this, I'll put that. So they try to threaten you, and those are the people. And we used to have a huge OPD and a OT. So the journalist would always come without the appointment, but the judges and the ministers would come with an appointment. And the politician, though you feel that they would be bad, they were very humble because they cater to patients, to people to get votes. So they are more humble than you expect them to be. If it is a close relative, it is a VIP patient because you will always think about them, your next door neighbor, because you have to see them every day. Friends, relatives, and a one-eyed patient. One must always remember that in our setup in our medical college, we always said that the one-eyed patient was the real VVIP patient, because you have to take extra precautions to see that whatever happens to the patient, that eye is not lost. Means to get the patient operated by the senior most surgeons, to give the best to the patient. Like, because it was a general hospital, if we were not able to do phaco for that patient, we would pay for the lens ourselves or with donation, so that the patient would have a small wound. So you have to keep in mind that the VVIP patient is not necessarily a VIP according to the rules of the society. You have to think who the actual VIP is. So what are the matters of concern over here? What are the do's and don'ts? So you have to examine and evaluate, like in any other patient, which is very important for all the patients, because you are a doctor and every patient is a VIP. But for example, if it is a politician who has security, who's the judge who has security, the timings of the judge are important, then you have to make their entry and exit quick. For example, we had Asha Bosleji as our patient, and she would get mobbed. She's quite old, so you have to be careful as to how her entry is, how her exit is, and how fast it is so as she doesn't get mobbed. Then we had a governor as our patient, and who got operated by sir. In fact, he was the governor of Kerala that time, Gavai sir. And I remember the SDO saying that you cannot patch the eye. Many years back, now topical we don't patch. But he said he has to go out into the car and you cannot patch his eye post-operative. So many things have to be taken care of. If you think that there is a dilemma, it is always good to take a second opinion so as to not make mistakes. And in the next few slides will tell you why. Lahane sir was just telling yesterday that you enter the OT when the patient is draped for yourself, because then you don't see the patient, you don't think that, oh God, you're operating so and so person, like say if it was somebody. And so you, when the patient is draped and when you see the eye, naturally all of us who are doing surgeries get transformed, and you start thinking only about the eye. So if the patient is draped, you are seeing only the eye. I think a little bit of help comes there. And Arjun had to see only the eye, and That is why. Chair time needed is more in many VIP patients. Like they need more time, they need more answers, they demand more time actually. So you have to give in to the demands if you are accepting such a patient, and the VIP syndrome can affect your diagnosis and decision making. There is always something or the other goes wrong in the VIPs, and that is how the VIP syndrome came into being. Touch only what you think you can lift. So one has to be very, very practical. The so many years that I was in JJ hospital with Lane sir, and sir used to do pediatric cases. I never ended up doing cases, and then after a certain time, I thought that there's so much ophthalmology to be done. This little child who is 19 days old needs the best surgeon, and so I won't touch this child. And then again, and I won't touch this child. And I never did pediatric cases. So there is so much to satisfy you as a surgeon. So you have to know your limitations. Whenever I had a black cataract, 1 month Lane sir was laid down with a back problem. I did all the black cataracts, I did SICS. I did not do phaco because I knew my limitations. So you have to know whether you can touch the VIP, whether you can do the VIP. One president, ma'am of India, was operated and she had a chronic red eye. Because wherever she was operated, maybe they got scared and all. So that is worse than not doing the patient. So, what are the pros? It can bring you a lot of fame and reputation. So, you are doing a VIP patient, and everybody is interested that where the VIP got operated, so that if the VIP considers that that doctor is very good, you will have a flock of patients. Sharad Pawar sir's brother-in-law, who was on the opposite party and who was the main person who fought the Enron controversy, Mr. N.D. Patil, he was first of Lahane sir's patients. And that is how the stream of politicians started coming to him in the last 30 years to judge, I mean, to almost all the ministers and all that. So it can bring you a lot of fame and reputation. But if anything goes wrong, like how I talked about the Honorable President, so madam who was operated by somebody else, and the second day after Lahane sir got his Padma Shri, he was called to see her eye. I will finish in 58 seconds. So it does increase the number of patients, it adds publicity, and every time a politician came, sir would extract money from him, from his MLA funds to build the government department. But it can go wrong, and you have to be very, very careful. So, one has to be very confident. Don't be shy to take a second opinion. VIP patients are extremely important. It builds up your confidence as a surgeon. Once you are very confident, you can go ahead. I hear so many people putting on Facebook that I operated my own mother, my own father, and it's very good. Go ahead and do it, but know how much you can do. Don't forget that at the end of the day, the VIP is also a human with two eyes, and you are his doctor and you are superior to him. So please keep that in mind. And they came to you because they considered you as the best person. So thank you very much for giving me the opportunity to be here and be with everybody. Thank you so much.
Thank you, Dr. Ragini, for that excellent talk and letting us know who the real VIP is.